Okay, tell me about the dental malpractice case.
This case is I don't want to say funny because it certainly wasn't funny for my client, but it's kind of crazy. It was very early in my career, and normally medical malpractice cases, including dental malpractice, anything healthcare related, is very difficult in California. The doctors, insurance companies lobbied the government in the 1970s, and they came up with the law called MICRA, which capped damages at $250,000 no matter what. The general damages at $250,000 no matter what the injury was, if it was caused by a medical malpractice.
Does it adjust for inflation?
No. So just recently, about 2 years ago, they adjusted it. But literally from the 1970s until just like 2023 or 2024, it was still $250,000, which is horrific when you think about. I had a client years ago, it's not the dental malpractice case, but I had a client years ago who became paralyzed from here down, actually just chest, just below the arm. So he had use of his arms. Just below the chest, or chest down, from obvious medical malpractice. He was at UCSF Medical Center, and he had had a benign, which means non-cancerous tumor next to his spinal cord. Routine procedure to remove it, was not dangerous, etc. They removed this tumor that was next to his spinal cord. In order to help from any blood clotting after a surgical procedure like that, they often give a drug called heparin. And heparin is a blood thinner, and it is administered with what's called a bolus dose and then maintenance doses. Bolus meaning a large dose to start. And so depending on your size, weight, etc., they calculate what an appropriate dose of heparin is to thin your blood so you don't get blood clots. And then they give little tiny doses after that to maintain that level of viscosity, the thinness of the blood, to prevent clotting. Well, what had happened to my poor client, after the surgery, nurse comes in and gives him a bolus dose of heparin, which thins his blood. Fine, no problem. Notes it in the chart. Shortly thereafter, another nurse comes in, doesn't check the chart.
Gives him another big dose.
Gives him another big dose, which causes extreme internal bleeding because now his blood is so thin, the blood vessels can't even basically hold it in, and any area that has been disrupted from surgery where the blood vessels are disrupted, they'll just bleed like crazy because they haven't healed. And so what happens, of course, if your surgical site is next to your spinal cord and then you receive a double dose, twice the amount that you're supposed to of blood thinner, you're going to bleed into that area. And what do you think happens when you bleed heavily next to your spinal cord?
Nothing good.
Nothing good. It ends up putting a lot of pressure and crushing the spinal cord at that area because of the massive internal bleeding, which left him permanently paralyzed from about the nipple line down. And because he was someone who worked on like he was a computer person, he could largely still do his job. And because of that, there was not a lot of what are called special damages, some life care in terms of some nursing care, etc. But for the most part, you you can live your life in a
I
wheelchair.
feel like loss of enjoyment of life would be astronomical.
Absolutely. If it weren't for the cap on damages, I wouldn't ask for less than $10 million. I mean, back then, and this was 2003, that case. So, or 2004. 2004, I wouldn't have asked for less than $10 million back then. Nowadays, paralyzed from the chest down, he had a wife and kids, I'd ask for $100 million. I mean, what amount of money is enough to compensate you for that? For never being able to walk again, never being able to make love to your wife again, never being able to play with your grandkids except from a wheelchair. But because of the insurance company's power and their lobbying the government to have the micro laws put in the 70s, all he could claim was for general damages, loss of enjoyment of life, $250,000. So we did end up settling that case. I believe it was a little more than $1 million we got because we were able to add the life care plan, the future medical bills, because when you are paralyzed from the chest down, you have a lifetime of follow-up medical care, catheters to help you pee, all of those things. So you can add some of that stuff up, but obviously even $1 million is not nearly enough to compensate someone for that.
I was wondering, for calculating that, does it calculate inflation over time? Because obviously, hypothetically, if you get the $1 million, you're not going to buy a whole bunch of catheters that day.
That's good that you brought that up. That yes, if you go to trial, your future medical expenses, for example, not your general damages, but your future medical expenses are what they call brought to present day value. So a dollar now is worth more than a dollar 10 years from now. And so they do a calculation to reduce future damages to what they call present day dollars. So there is a calculation for that.
So a dollar now is less than a dollar.
But because of the ability to grow your dollar now, basically there's an assumption that you can grow your dollar faster than inflation. Whether that's true or not depends, of course, on your ability to invest your money. But in the law essentially recognizes that typically inflation, now we know lately it's been a lot more, but typically inflation is around 2%, 2.5%. That's historical. And you can typically grow your money maybe by 5% on average. And so the idea is if you can grow your money more than inflation's happening, then you have to reduce the amount that you have your future damages down to present day dollars, so you end up getting less. So you probably thought you'd get more because you need more money in the future because of inflation. You actually get less because the law assumes that you can grow your money.
That's bullshit.
Yeah. Obviously, if you invest well and the market does well, then that's true. But
but you also can't you'd have to still spend some of a portion of that money for the medical stuff you need now.
Yeah, as you go.
Mm-hmm. And then you'd have to invest a chunk of it I don't think the math works.
There are economists. So typically what we do is we actually hire, I'm not competent to make that calculation, and neither is the judge. So typically both sides will hire economists to talk about assumptions and what are the reasonable assumptions, and to calculate the present day value of the future needs, et cetera. And of course the defense expert always makes assumptions based on oh wow, there's all these great investment opportunities and all that kind of thing. And the plaintiff side is a little more conservative with how much you can grow your money and all those kind of things. And speaking of what often the defense does, in cases of medical malpractice, where someone is in a wheelchair, and not just medical malpractice, but where the injury is someone resulting in being in a wheelchair. There's an expert in California who is an expert in calculating the future needs of someone who's wheelchair bound, and he's wheelchair bound, but he always works for the defense. And so the defense loves it because they can have him wheel himself into the courtroom and say, "Oh, my life is fine, and I don't need, people in wheelchairs, believe me, ladies and gentlemen, I'm an expert."
So he's pretty much Samuel L. Jackson in Django.
Yes, yes. It is remarkable that he, as a wheelchair-bound person, has devoted so much of his life to trying to minimize the recovery of wheelchair-bound people. It's pretty horrific. I think that's terrible. I don't know how he looks himself in the mirror. But in any event, yeah, the defense loves trotting that guy out, and because he'll write these reports about he's wheelchair bound, and so he's the foremost expert in California about what people's needs are when they're in a wheelchair, and he's been in a wheelchair for 20 years, et cetera. And he makes a fortune because, of course, insurance companies they'll pay him a lot of money to save them a lot of money. In any event, I got on this tangent talking about medical malpractice and how bad it is in California to have to bring those cases. Talking back about this dental malpractice case. So dental malpractice cases are even more rare than medical malpractice cases because they don't usually result in anything that is so significant that it becomes worth bringing a case over. Like, let's say the dentist is trying to do a filling on your tooth and he cracks your tooth. Okay, that's bad. Don't get me wrong. It sucks. Maybe you even need to get an implant or a bridge or something. But we're talking about, damages of a magnitude of maybe $10,000 or something, which is not worth bringing a case over because it costs more than that just to hire an expert to say that it was malpractice. So it just doesn't make any sense usually. So dental malpractice cases are pretty rare. And this was an unusual one because it was one in which the majority of damages were psychological in nature. So let me tell you what happened. Our client goes to the dentist, and the dentist says, "Oh, we need to build a bridge, and you've got a couple of teeth that are, rotten, no good, roots gone, etc. So we're going to pull those teeth out, and then we're going to build a bridge, and your mouth will be beautiful." She goes, "Okay." So she goes in for her appointment for her extraction of her teeth, and then the doctor, she's lying there. Doctor pulls these two teeth out. And if I recall, it was her eye teeth, the canines, the big ones. Pulls those teeth out, and she's getting all wrapped up, and the nurse, the dental assistant, comes in and pulls the doctor aside, the dentist aside, and says, "You pulled the wrong teeth out." And the dentist goes, "Uh-oh, better call her back in." Calls the patient back in to the office, says, "Sorry, we pulled the wrong teeth. We're going to have to pull the other teeth." But before he did that, he went to the dental assistant and says, "Where are her teeth?" "Oh, well, they're in the biohazard waste bin with, other people's bodily fluids and teeth and things like that." He's like, "Okay, just take them out. So my client goes in, and he's like, "Sorry, we pulled the wrong teeth, but it's no problem. I have them right here." And proceeds to shove them back into her mouth. Now, this is the next day.
Did they clean them before?
Yes, kind of. But, well, they say they did afterwards when they were caught. But no, the dentist says, got your teeth right here, puts them back, jams them back up into the sockets, which any dentist will tell you. And as you know, your grandfather, my father, is a dentist. And he will tell you, once the teeth have been out for a day, there is zero chance that they will ever be able to be put back in. So what happens? Sends her home. Her teeth are just wiggling around, dangling like loose piano keys. And of course, they just fall out. And that night, while she's at home, she gets a call. Phone rings. She picks up the phone and she hears this husky woman's voice on the other end of the line that says, I'm just calling to tell you, they fished your teeth out of the biohazard bag. You should get yourself tested for diseases. Click. So my client goes into an absolute panic. This is back in around 2004, 2005. So, while we're past the AIDS epidemic, it's HIV AIDS is still a, fairly strong concern, et cetera, et cetera. And so anyway, that's what that case was about. And it was about she ended up having to get tested for all types of communicable diseases, follow-up tests, et cetera. I mean, she was legitimately worried. And that dentist, shouldn't have pulled out the wrong teeth. It's not that hard to figure out which teeth you're supposed to pull when it's right in the chart, and number one. And number two, you don't lie. There's a saying, it's always the cover-up and never the crime that gets people in trouble. If he had just been honest, he wouldn't have gotten sued.